It's been a long 3 years, but the WHO has finally declared an end to the global COVID public health emergency, and the United States government is set to follow suit. San Diego's La Maestra Community Health Centers is celebrating that milestone and their 33rd anniversary in person, says the organization's Cynthia Kaiser.
We're transitioning from many of our visits happening virtually, opening our doors and doing a lot of expansion in the community so there's an increase of access.
On May 11th, the U.S. is expected to end the national COVID-19 public health emergency. That means the sunsetting of some health coverage and cost savings put in place during the COVID-19 pandemic. Kaiser says they're trying to inform people through community outreach.
There's more changes that are happening with the emergency Medi-Cal, and different campaigns are underway to get the message out to our patients and our community on the renewal so that they can maintain with coverage.
People will now have to pay for their at-home COVID tests and stay in their healthcare network to receive COVID vaccines and PCR tests. Plus, patients on controlled substances and many other medical situations will no longer be able to use telehealth for their prescriptions, says health insurance expert Luis Norris.
So this is really a situation where if you're on Medicare and you've been utilizing these telehealth flexibilities, which a lot of people have, you're going to want to check with your doctor and see what changes are happening.
Even though the COVID emergency is almost over, UC San Diego infectious disease specialist Francesca Torriani says the next pandemic is just a question of time, so the U.S. and the world needs to learn from the mistakes it made with COVID-19. Her advice?
Strengthening public health, the public health response, the public health ability to screen for these diseases and to respond to a threat and mitigate very fast to a threat.
Jacob Ayer, KPBS News.